Hello, everyone. I'm Altasha Mondesir, and today I'm excited to present an in-depth presentation about HIV/AIDS epidemic in the Bahamas, focusing on its epidemiology and control efforts. This small island nation faces unique challenge in tackling this public health crisis, and we will explore the background, trends, and strategies. Bahamas is a stunning archipelago with a land area of about 14,000 square kilometers. Its population is just over 400,000, mostly concentrated in urban areas like Nassau. As a developing nation, it boasts a high human development index but relies heavily on tourism, which makes up 75% of its GDP. Political stability is a strength, but high public debt limits healthcare funding. With an HIV prevalence of 1.9%, the Bahamas faces one of the highest rates in the Caribbean. Let's look at how this epidemic began. HIV/AIDS first emerged in the Bahamas in 1983, rapidly escalating in the 1980s. By the 1900s, prevalence hit around 4%, a critical high. Thanks to quick interventions, it's stabilized at 1.9% today. We still see about 1,200 new cases annually, but the good news is mortality has dropped dramatically by 77.5% since 2000 due to better treatment access. Next, let's examine how the country tracked its epidemic. Surveillance in the Bahamas relies on three main methods: sentinel surveillance, monitors pregnant women at urban clinics, giving us a window into heterosexual transmission. Case reporting is mandatory, capturing diagnosed cases in hospitals, while behavioral surveys target high risk groups like sex workers. But there's a catch. These are mostly urban focused, leaving rural family islands underreported. This gap makes it hard to gauge the full epidemic, especially in remote areas. Now let's talk about epidemiology. The burden of HIV/AIDS in the Bahamas is heavy. About 7,600 people live with HIV, with a prevalence of 1.9% among adults. Each year, we see around 1,200 new infections, and while mortality rate has dropped to 32.6 per 100,000, the disease still strains society, reducing productivity, increasing healthcare costs, and perpetuating stigma, especially in small communities. How does this compare regionally? Let's see. Chart on this slide puts the Bahamas in context. At 1.9%, its HIV prevalence is slightly higher than Haiti's 1.8% and Jamaica's 1.5%, but much higher than Cuba's 0.4%, which benefits from strict public health measures. While the Bahamas has lower mortality than Haiti, its high prevalence shows the need for stronger prevention. Let's talk about who this mostly affects. HIV hits certain groups harder. Women have a higher prevalence at 2.1% compared to men at 1.7%, reflecting gender vulnerabilities. Sorry. Adults aged 25 to 44 make up 60% of cases, with a peak prevalence of 3.2%. Urban areas like Nassau report 2.3%, while rural areas are lower at 0.8%, likely due to underdiagnosis. Data on race is a bit scarce, but most cases are among Blacks. Mortality is also higher in urban areas. Why are these rates so high? Let's look at risk factors. Over 80% of HIV cases come from heterosexual transmission, driven by several factors. Gender-based violence limits women's ability to negotiate safe sex. Nearly half of adults report inconsistent condom use, and sex tourism in urban areas fuels infections. Stigma is a huge barrier. Many avoid testing due to fear of disclosure in small communities. High-risk groups like MSM and sex workers face even higher prevalence. So what's being done to stop this? The Bahamas has a long history of fighting HIV. Early efforts in the 80s and 90s focused on awareness and testing sites. Today, The National HIV/AIDS program shines with over 80% of diagnosed individuals on ART, slashing transmission risk. Free condoms are distributed widely, and mother to child transmission is down to under 2%. Outreach targets high risk groups, and social media engages youth. But challenges remain. Let's explore those. Control efforts face serious hurdles. Stigma keeps people from testing, especially in small islands where privacy is scarce. Rural family islands lack healthcare access, and treatment is costly with little government support. Hospitals have long waits, medication shortages, and shockingly, no confidentiality, with staff leaking patient information. Some even demand patients secure blood donations, which is unethical. Funding is high due to high debt. But how effective are these overall? Bahamas has some wins. Prevalence is stable, mortality is way down, and incidence dropped 4% in a decade. But the overall picture is grim. There is no financial support for patients, hospital care is no privacy, and rural areas are neglected. Forcing patients to find blood donation is unacceptable. These failures mean the country's efforts are poor and far from UNAIDS goals. So, what's the solution? My proposed strategy is mobile testing units. 5 units will visit 10 family islands monthly and urban high risk areas, offering rapid, anonymous HIV tests, counseling, and ART. Pair educators will build trust, and telehealth ensures follow up. Backed by PAHO and tourism funds, this could boost testing by 20% and ART adherence by 15%, tackling stigma and rural gaps. It's a step towards those 95, 95, 95 targets. To wrap up, the Bahamas faces a heavy HIV/AIDS burden. With a 1.9% prevalence, control efforts have stabilized the epidemic, but stigma, rural gaps, and poor hospital practices hold us back. Mobile testing units offer hope, but we need more funding and strong confidentiality laws. Let's support innovative strategies and end this epidemic. Thank you for listening, and I'm happy to take your questions.